Hey, it's Melanie Petro, and I'm here with someone who is going to share with y'all how and who do you trust to do your Botox. Cost is always an issue. We try to do things like today we're doing a walk-in clinic and we're giving away dermaplane, but everybody comes back to how much is it? How much is it? So why does it matter? I mean, who do you go to? And she has a story that I think it tells you a lot, and it's hard to go around saying, well, I do a lot of Botox. I mean, it does matter who you go to, and you can make a difference, because if you do it and it doesn't turn out well, you're kind of with it for 3 months. So, and when you have people, I've heard a lot of that today, and I'm sure there are people very well qualified all over doing it, but it's also mixed with people that just kind of open a back room in their office and decide they want to do it. To me, you can't do anything and do it really well if you don't love it, if you don't feel it with all your heart. And you can tell how much people love things by how much they do it. I do my own. I get a lot, some people think that's great. Some people think it's a little odd. I can tell you that the day I find someone that will pay as much attention to my every little line as I do, first I want to hire them to help me because I would love for people to see what I see in the world, because I feel like everything would be more the way I like it. But I've never found anyone that could do that. They don't, everybody looks at things differently, and I look at them and see a lot. I can handle some things different. I'm not OCD about everything, but I think that how your face looks and where your lines are and how you treat it in order to not end up looking weird. I mean, I think it's really, really important. So we have a patient today that's going to share. We're not going to show her face. I'm going to show her foot. Because I want you to know she's real and she's had an experience and she is willing to share it. And there's nothing better than that. So she is going to tell us.
So I had my first experience with Botox back in February or March in the spring. I went to a local doctor from where I'm from. And after about 7 to 10 days, I noticed that one of my eyes was drooping. And so I called back and they said that it would just eventually go away. Well, it eventually went away after, 2 months when my Botox wore off. So I did some more research and I found Dr. Petro, and I watched a lot of her videos on Facebook, and I researched a little bit about her, and I knew that she would not do anything to me that she wouldn't do to herself. And I really appreciated that. And so when I came for my consultation, she explained everything thoroughly and told me that there was a solution for the problem that I had experienced. And that was also good to know. And so I'm back for my second round, and I'm excited.
So this was a doctor that was a general doctor that kind of just kind of started doing Botox.
Yes.
At the time, did you know, I mean, I guess you didn't know, or you wouldn't have done it. You didn't really know that it can be different. I mean, it just kind of seemed like something we make it fun with sprinkles. But I mean, I'm very well trained. I'm a diamond level provider. We do a ton of it, but I don't know that I think we focus so much on trying to tell people it's okay. But the reason for these videos is to educate people, because it's unfortunate, because you might not have ever tried Botox again.
Right, and I was not planning on it until I found you.
So how do you feel about the Botox? What was your favorite thing about it when I did it?
Oh, when you did it? Oh, wow. It was totally different from my first experience. You did it, actually, when I came to you, you told me, okay, since you've had a bad experience, let's take this kind of slow and let's do it in stages. And we started with an area between my eyebrows, where my 11s are, the area that worries me the most. So we took that area and we did it, and you told me to come back in a few weeks, and I'm back.
So what do you like the most about the area between your brows?
Oh, wow. It's given me, it's really smooth. I have no lines there anymore. It's kind of opened up my eyes a little bit.
So it's supposed to lift your brows when you do it there. So right. I've been hearing so much today about getting different things. I know, isn't she great? And how it is hard to know who to trust. I mean, I still am that person. Like, there's a store here, and I can't say the name, but I've only been in there once, and they had all of these brands that I loved, but they were old. They were like from 2 seasons ago. I felt deceived. Like, I mean, it's just deception is not a good thing. So when you go around and you compare pricing for Botox, or you compare this or that, I mean, I like to add services to it. I like to be able to give people dermaplane and things that make them better, but it's really not, it is, if it goes well and you get what you want, it's a wonderful thing. But if not, especially as women, we don't feel like we can get out and say, I'm not happy with this.
Right.
I can tell you, I tried one time to tell somebody who did something, I didn't like it, and he just looked at me like I was from outer space. And that's not a good feeling. I mean, you already feel this level, some degree of inferiority. I don't want to say inferiority to men, but they're bigger and they talk louder, and, I mean, you still always feel like a little bit, when you tell them something, it's not as easy.
Right.
And so, you tell them something and it's just like.
Well, and I feel like with you, you want the best for your patients, just like you want for yourself. And whatever you would want and use on yourself is what you give to us as a patient. And I really appreciate that. Okay. And if it's something that, you don't feel like would work for me, you tell me. And I really appreciate that.
Well, I love what I do. I'm glad you're here. I'm glad you had a good experience, and I really appreciate you sharing, because that's what it's really all about. It brings everybody together. It lets everybody know there may be people out there that have had your experience. Yes. So Tish is about to give me an experience. Okay. All right, y'all say hey to Tish. Well, I can't use that side of my camera because I've dropped my phone too many times. Have a good day. We'll see you later.